Hello, everyone, and welcome to our February webinar focused on the key findings from the 2018 College Prescription Drug Study. I'm Cindy Clowner with the Higher Education Center, and we're so excited to have our partners from campus here at Ohio State that work in the Center for the Study of Student Life and Student Life Student Wellness Center, who've been doing a lot of great work around collecting data on collegiate prescription drug misuse patterns. Before we begin, I just have a little bit of housekeeping that I'd like to discuss. We welcome your questions throughout the webinar, and our presenters will respond to those at the end. So if you have any questions, we encourage you to submit them through the question box in the right-hand control panel of your screen. We also encourage you to learn more about becoming a member of the Higher Education Center. Annual membership benefits include access to our ScreenU suite of tools. ScreenU is a web-based screening, brief intervention, and referral to treatment program, and we have programs that focus on alcohol, prescription drugs, and marijuana. Additionally, campus members receive unlimited access to our learning collaboratives, which are a series of web-based trainings around a specific topic, including learning collaboratives on cannabis, collegiate recovery, prescription drug misuse, and how to engage peers in working across the continuum of substance misuse on a college campus. And with that, it's my great pleasure to introduce to you our panel of presenters today, Dr. Ann McDaniel, Dr. Erica Phillips, Nikki Adams, and Blake Marble. And they're going to each introduce themselves and tell you a little bit more about where they're coming from and the role they had with this study.
Hi, this is Dr. McDaniel. I'm the Executive Director of the Center for the Study of Student Life here at The Ohio State University. I've been leading the prescription drug study since 2013, and I'm excited to share our findings from our most recent administration with you all today.
I'm Erica Phillips. I am a co-investigator on the College Prescription Drug Study and an associate director in the Center for the Study of Student Life. So I help oversee a lot of our administration and analyses with the CPDS.
I am Nikki Adams. I'm a research analyst for the Center for Study of Student Life, and I help with a lot of the analyses with this report.
Hi everyone, my name is Blake Marble and I'm the Director of the Student Life Student Wellness Center at Ohio State University, and we are a partner with the Center for the Study of Student Life in administering this study across the nation, and I'm going to share with you a little bit today about how we implement some of the findings to some of the practice that we do in the Student Wellness Center.
So today, a little bit of a roadmap of what we're going to talk about. We're going to go through an introduction of the College Prescription Drug Study. We're going to go over some of our key findings looking at the frequency and access to prescription drugs, reasons for and consequences of use, alcohol and other drugs and their relationship with prescription drugs, education and resources, and prescribed medication behaviors. And then we're going to spend some more time talking about translating the CPDS findings into practice. And we will welcome your questions and thoughts throughout on any of these topics. So what is the CPDS? The College Prescription Drug Study is a multi-institutional survey of undergraduate, graduate, and professional students that examines the non-medical use of prescription drugs via an online anonymous survey. The history of the study is we started it on Ohio State's campus in 2009, and we were really interested in understanding in depth how our students on our campus were misusing prescription drugs. We had noticed through some of our work in the Student Life Student Wellness Center that students might be struggling with or having questions about prescription drug misuse, and we wanted to understand that a little bit deeper. And while we had some really great information from some national studies, like the National College Health Assessment, that might ask a handful of questions on students' prescription drug misuse, we wanted to really understand students' motivations for misuse, consequences of misuse, and get into some deeper details about that misuse. So we partnered with our College of Pharmacy and some faculty members there with the Generation RX initiative to understand students' prescription drug misuse. Our key research questions were, what types of drugs do students misuse and or abuse? What are the demographics of students who are the most likely to misuse or abuse prescription drugs? Why do students misuse? And are students who misuse prescription drugs more likely to abuse other non-prescription medications or use illicit drugs? So this Spring 2018 administration of the study that we're going to share the findings from is the second time we've done this on multiple campuses, our first being in 2015. And again, this is building on research that we've been doing at Ohio State for a decade now. So what we did was we worked with 26 institutions across the United States and selected random samples of students from each of those institutions to receive the survey instrument. So we had 18 four-year public institutions participate, 7 four-year private institutions, and we had 1 community college participate. So we sent the survey via email to over 113,000 students nationwide, and we had almost 20,000 respond for a response rate of 17.1%. So to our knowledge, this is the most in-depth and comprehensive study of college prescription drug misuse to date. So now we'll share some of those findings with you, and I'm going to turn it over to Dr. Phillips.
Sorry, I was muted. So we, for those of you who are sort of interested in really following along with us, if you go out to this website, it's going to take you to a PDF of the key findings report from the 2018 CPDS. We'll put this up again at the end of the slides as well to send you to our website to get more information, but just wanted to let you know that it's available if you're interested in a PDF version of a lot of what we're going to talk about today.
Okay, great. We will start out by looking at the frequency of use and access to prescription drugs. Within the CPDS, 9.1% of respondents reported that they had ever misused pain medications. 9.4% had ever misused sedatives, and 15.9% had ever misused stimulants. Also, 22.6% of respondents had ever used any of the 3 types of prescription drugs, and 13.3% of respondents reported that they have used more than 1 prescription drug non-medically at the same time. This chart compares non-medical use of stimulants between class ranks. 25% of respondents who had ever misused stimulants identified as 5th-year plus undergraduate students. This is compared to 22% of 4th-year and 19% of 3rd-year students. As illustrated in the chart, the number of students that reported sedative misuse increased each year from 1st-year undergraduate at 8% to 5th-year plus undergraduate at 15%. Among graduate and professional students who reported ever misusing prescription drugs, 11% of master's student respondents reported pain medication misuse, as well as 7% of doctoral students and 8% of professional students. When looking at the misuse among only those students who reported ever misusing prescription medication when referring to the previous 12 months, 44.6% of respondents reported that they had misused pain medications at least once. 57.9% had misused sedatives, and 62.9% had misused stimulants. When asked when students began misusing prescription medication, the majority of stimulant users, which is 65%, and sedative users at 52%, began misusing during college. Almost half of pain medication users began misusing during high school at 48%, and 39% began misusing during college. Very few respondents reported beginning to misuse prescription medications in middle school or earlier. As you can see, there's a spike in starting stimulant misuse during college. Blake will later tie in how the Student Life Student Wellness Center is addressing this. Understanding how students access prescription drugs for non-medical use provides important information that can help practitioners and scholars understand the patterns of prescription drug misuse. All student respondents were asked how easy it is to obtain prescription drugs without a prescription. They were also asked where they typically obtain prescription drugs that they use non-medically, which I will address in the next slide. 28% of respondents reported that it was very or somewhat easy to obtain non-prescription stimulants, compared to 20% of sedatives and 16% of pain medications. Remember, this was all students who participated in the study. It should be noted that this question was only asked to students who misuse. Students obtain prescription drugs for non-medical use for a variety of sources, including people they know, such as friends, peers who are not friends, and relatives. Students who were most likely to report obtaining prescription drugs for non-medical use from a friend across all types of prescription drug types. This chart highlights some sources where students obtain prescription drugs for non-medical use. As you can see, the majority of students who reported misusing said that they obtained the prescription drugs from a friend.
Okay, so now we're going to talk about sort of our next section here, which is the reasons that students self-reported to us that they were misusing prescription drugs, or their consequences of use. So what are some of the effects that students are articulating as part of the survey in terms of why they chose to use stimulants, pain medications, and sedatives? So first, we asked students a whole host of potential reasons that they potentially chose to use non-medical or to use prescription drugs non-medically. And so of that whole host of reasons, there are probably, 12 to 15 on this survey that students could kind of choose from, in addition to a write-in answer and an I'd rather not it say answer. These were some of the things that students were most likely to report. So students who reported that they were using pain medications, students were primarily saying that they use those pain medications to get high, to relieve pain, or to see what it was like. So here, and then fourth, to sort of relieve anxiety. So when we're looking at these pain medications and reasons that students are saying they're using them, we're really getting a narrative here of students who are perhaps doing some experimentation in terms of getting high and seeing what it was like, but also students who are potentially self-medicating in terms of trying to relieve pain or relieve anxiety. We see a similar theme when we're talking about sedatives and why students are reporting that they're using sedatives. So they're trying to sleep, they're trying to relieve anxiety, but then, in terms of their third and fourth reasons for saying that they've used sedatives non-medically is for that getting high or to see what it was like. The narrative changes a little bit when we get to stimulants. So when we're talking about stimulants, students overwhelmingly said that they were using stimulants to study or improve grades, although just over a fifth of students said that they were also interested in seeing what it was like or enhancing social situations. So it is sort of mixed reasons that students are reporting they're using these prescription drugs without a prescription, but especially for stimulants, it really is an academic focus. And so that's something that we're continuing to dive into in terms of understanding students' reasons. We also asked students about sort of their reported consequences of their use of pain medications, sedatives, and stimulants. So for pain medications, overwhelmingly, well, I shouldn't say overwhelmingly, it's 22%, but students were most likely to report that they had experienced depression, memory loss, or done things they wish they hadn't as a result of their pain medication use. We see similar reported consequences among students who are using sedatives. So students who are using sedatives also are reporting, about a fifth of them are saying they had done something they wish they hadn't, or that they'd been depressed. But where sedatives really diverge and we get some different responses is in the most reported response, which is that students experience memory loss. So over a third of students reported that as a consequence of their sedative use. And then we're to stimulants, which again have a very academic focus in terms of the reported consequences that goes along with the reported reasons for misuse. And that's because 60% of these students are saying that the stimulants had a positive effect on their grades. So students are self-reporting a connection between misuse of stimulants and a positive academic effect, which is something we want to continue to dive into as we think about the results of this study and how they can inform higher education practitioners in the wellness space. We also asked students a number of questions about alcohol use and other drug use, rather pretty broadly, to really get an idea not only of which students are using these substances, but also how are they potentially using them in combination with one another. The alcohol questions are also really useful to us because we were able to ask at least some of the alcohol questions to all of the students. So as Nikki mentioned, most of the students who participated in this study took a really short survey because they were not using prescription drugs for non-medical reasons. So fortunately, we're also able, though, through the study to get some general wellness information about students in terms of what you see on your screen here. So how often are you potentially using drugs or alcohol to manage your stress? What does that look like? The survey also had some other general wellness questions that we won't dive into too much here, but they can be sort of an additional useful information for any campuses that are participating in this study. So in terms of what's on your slide here, students overwhelmingly about half of them are not using drugs or alcohol to manage their stress. We are still worried, though, about the 45% of students who are saying that they at least occasionally or rarely are using alcohol or drugs as a stress management tool. And we're particularly interested in the 21% of students who are sometimes, often, or always using drugs or alcohol as a stress management technique. Again, as we think about sort of the role of colleges and all that we can do to kind of understand this, really talking with students about what does this look like for them continues to be really important to provide, future insights into the data here. So we also asked students, and so this slide is students who reported that they had used pain medications, sedatives, or stimulants non-medically. But we asked these students if they were more or less mixing their use of prescription medications non-medically with their consumption of alcohol. And so this is something that, is really important to our partners in the College of Pharmacy, that's really important in terms of the higher education center's work, that's really important in terms of the work of the Student Life Student Wellness Center, because what sort of we're seeing in this chart is that while most students, over 50% of students who reported using any of these types of medications non-medically, they weren't combining them with alcohol. So that's positive. But again, similar to the other slide, we're still seeing about 20% of students, between 15 and 20% of students across all of these types of medications who are potentially using prescription medications while drinking alcohol. And there are potentially serious consequences for mixing sort of those substances together. So, understanding that and then, translating that into something like the GenRx University Initiative in terms of helping students to understand the potential consequences that can come with mixing those medications and alcohol. We asked students who reported that they had misused prescription drugs if they had ever used illicit drugs in place of prescription drug misuse, and over a third of them reported that they had. So that 35% in the orange circle is the percentage of students who said, yes, I've used an illicit drug in place of a prescription drug. We know in some places marijuana is no longer considered an illicit drug, but in terms of the purposes of this study, we kind of put it in there as one of those options. And as you can see, a lot of students who said that they had used an illicit drug in place of a prescription drug, they were overwhelmingly using marijuana, although a fair number also reported using cocaine, ecstasy, which is MDMA, and hallucinogens. Very few students in our sample reported heroin use or fentanyl use. So I think that's also useful to know that when we're thinking about illicit drugs in place of prescription drug misuse, we're really, in terms of college students at least, talking about marijuana, cocaine, hallucinogens, those kinds of things. So we also wanted to talk with students and sort of have students tell us about the kinds of education they were aware of around safe prescription drug use, as well as if they were aware of resources to educate themselves and if they knew where they wanted to go to get help. So for the most part, students were really knowledgeable about resources available to help with prescription drug safety. So the first pie chart on the left was asked of all students and really asked students if they knew about resources for prescription drug safety. We were really excited that over a third of students could identify a place on their campus where they could, get information about prescription drug safety. And over half of the sample sort of knew generally where they might find a resource about prescription drug safety. On the right, we asked students who reported non-medical use of one of the three types of drugs, the pain meds, sedatives, or stimulants, if they were aware of where they could go if they needed help or if they were worried about their personal prescription drug use, the non-medical use. And most of these students, again, really knew where they would potentially be able to go if they were concerned about their misuse. And we were really intentional in kind of how we asked this question because we really wanted the students to not be negatively thinking about their non-medical use or being primed to think about their non-medical use. And so we were really excited that students really responded and said, yeah, if I, needed some help, I would know where to go to get some help. All right. The last sort of section of the instrument that I want to talk about here is a piece that I'm pretty excited about that kind of builds on the education and resources piece, because we asked students who had had a prescription for stimulants, sedatives, or pain medications in the past 12 months to self-identify. And then for those students who said they did have one of these prescriptions in the past 12 months, we asked them some follow-up questions about their medication use, what they did with their prescription, where they stored it. So I'm going to talk about that in the next few slides. But again, this gives us another kind of angle to be understanding the cycle and the sort of network of prescription drug misuse and just generally use, and sort of understanding the ways in which the interplay of those could be really important for thinking about continued education, thinking about continued resources that students might be able to use. So this first slide, again, these are students who reported that in the past 12 months they'd had a prescription for pain medications, sedatives, or stimulants. And so of those students, 8% were keeping their prescription medications in a locked space. So that's our fourth bar to the right. The majority of students really were not keeping their medications in locked spaces. Usually it was in an unlocked medical cabinet, an unlocked drawer cabinet, maybe they were carrying it with them in their purse or backpack. So when we have discussions about sort of safe prescription drug use, that physical safety, we're really seeing some of those questions here in terms of these prescriptions not being kept in sort of locked, secure spaces. We also asked students what they had done with their prescription medications in the past 12 months, and we were really interested to kind of learn more about the results. So here on this chart, you can see that especially among pain medications, over a third of students kept their prescribed medications after they were medically needed. And so I think it's most interesting that, pain medications, that's more than 30%, but sedatives is strong too, almost getting to 30% as well. The other piece that sort of the CPDS research team is continuing to unpack and continuing to find really interesting is that among these students who had a prescribed medication, many of them, especially people with stimulant prescriptions, were selling them to friends or giving them to a friend or peer. Fortunately, we're not seeing a majority of students doing this, so that's good. We're not getting over that 50% mark, but we still have 21% of students with a stimulant prescription saying that they'd given it to a friend or peer, and 11% of these students saying that they sold it to a friend or peer. So continuing to have those conversations about prescription behavior and prescription safety, continues to be really important. And, something I often think about is how interesting it is that in terms of people selling to a friend or peer, we're not seeing quite the same distinct pattern amongst sedative users and pain medication users. It's much lower. And so I think having continued conversations with students about what are the narratives that they're reading or knowing about, that they're not selling that pain medication, even if they're keeping it after it's medically needed, that maybe could be translated to a stimulant sort of sphere. So now we're going to talk with Blake about translating our CPDS findings into practice and what that looks like.
Thank you, Erica. So before I get into this, I just want you all just to take a couple seconds to think about the prescription drug misuse efforts on your current campus, and what are some of the challenges that you're facing when it comes to addressing these issues. That's something that we think about a lot here, and I think that we have to acknowledge the fact that there are other wellness challenges and issues that are more prevalent than prescription drug misuse on our college campuses. I think that you look at the alcohol use, you look at even marijuana use, you look at these other substances that are pushed towards the forefront. Because it's just more prevalent. 16% of students misusing stimulants, that's certainly not the majority. But we don't want to overlook this issue. We want to be sure that we are addressing this issue just like we are any other issues, because we know that this can impact student success, this can impact their retention rates, and this can impact them for their entire lives moving forward. Another thing that we have to think about is that prescription drugs are made available in different ways. Obviously, prescription drugs are prescribed by a physician. Medications are oftentimes easy to transport or hide. And to be honest, we all know that they do have health benefits too. So they're accessible in many different ways, and they're accessible in ways that are different from other substances. Another thing that we need to consider is the graph that Erica showed earlier, it shows that students are oftentimes using to perform and to enhance their performance. Some students are still using to get high and for other reasons, but the competitive nature of higher education today um, has really caused a huge amount of stress on students. And if you ask any of the chief student affairs officers or any higher education administrators, they're going to tell you anxiety and depression are some of the number one concerns that they're facing on their college campuses. And a lot of that stems from the pressures that are being put on students to compete with one another, to maintain high GPAs, to be competitive when it comes to internships, et cetera. And what we're finding is that students are using stimulants, for example, as a means to get ahead in the classroom. I also wanted to mention this, and when we talk about the accessibility of prescription drugs and how it's so different than other substances, I read an article, this has been a couple of years now, about a group of students who were completing a class project at the University of Wisconsin. And as part of this class project, they wanted to see how long it would take them to find Adderall in the campus library from someone whom they didn't know. So this group of students went into the library, and it took them 56 seconds to find access to Adderall in the library. So I think that in itself shows that if you go to the right place and you're asking the right questions, it can be a very accessible substance. So in hindsight, it's not the most prevalent issue, of course, but it's one that's worth addressing for sure. So I wanted to highlight some of the initiatives that are taking place on Ohio State's campus, and this certainly isn't all of the initiatives that are going on, but there's some of the ones that we're most involved with. The first that I wanted to highlight is a social norm campaign that we're actually wrapping up the content development stage of that campaign right now. It is focusing on a couple key themes, and Erica and Nikki mentioned these themes earlier, but our social norm messaging is focused on using stimulants to study, because we know that that's oftentimes a motivating factor for students to use stimulants, and it's focused on mixing prescription drugs and alcohol. And we know that the vast majority of students are not engaging in these behaviors, and we want to use that to our advantage and help correct some of these misperceptions that might be out there. So although we're developing a campus-wide comprehensive social norms campaign that will be housed in residence halls, all over social media, within student unions and across campus buildings, we're also using these social norms in our one-on-one interventions. So we're incorporating social norms around prescription drugs in our basics interventions, in our K6 interventions, and we want to be able to get this information in students in as many of ways as possible. In regards to social norms, I do want to mention that there are resources out there to help you develop social norms campaigns on your own campuses. Michigan State University has an excellent social norms center that is housed on their campus, and they're extremely helpful, and we actually sought them out when we were developing some of the content for our campaigns. And I also want to mention there are also grants available to help start social norms campaigns across campuses. So please do not overlook the resources that are already out there. I also wanted to mention that with our social norms campaigns, we're not just correcting misperceptions, but we're also getting at a point that Erica made about connecting students to resources. So with accompanying each of our social norms messaging, we're including a website and a link to resources where students can easily access the different support services that are on campus, from prevention all the way to treatment through our recovery community. So we are fortunate enough to have services across the entire continuum here on our campus that students can easily access, but our number one goal is to make them aware of all of these different resources. In addition to our social norms campaigns, we also have a rather large group of undergraduate peer educators who go out and they facilitate workshops on a variety of wellness topics. But one of the topic areas that we've really started to build out is our prescription drug prevention work. So a lot of the messaging that they put out focuses on knowledge, attitudes, behaviors, and building skills. In my opinion, the skill building is one of the most important pieces of this, because we know that students are misusing prescription drugs to perform, to study better, to sleep better, to manage these different stressors in their life, and we want to provide them the skills to do that in a healthy way. So what are some ways we can enhance study skills? What are some ways that we can enhance stress management skills? What are some good sleep practices? So that's a lot of what our student peer educators do, is they educate students on how they can incorporate these skills in their life in a healthy way. A lot of our peer education efforts target the first and second year population. That's the two groups that we have the most access to, but we also want to target some other high-risk populations. We know that prescription drug misuse is oftentimes more prevalent in the veterans community or in the LGBTQ community, so we want to get creative in how we approach these specific populations. In regards to collaborations, I put this in there because I just wanted to stress the fact that prescription drug misuse is not an issue that one department can address on its own. You know, oftentimes we, in wellness centers or health promotion offices or even student health services on some campuses, we house the staff who are focused specifically on AOD issues. But anything related to wellness should be something that all higher education administrators address in their daily lives. We need to ask students questions. If we see things that are abnormal, we need to also intervene regardless of our roles, and we need to incorporate wellness in all that we do. One of the things that we're trying to really focus on here at Ohio State's campus is how can we as a student wellness center, knowing that we don't have a plethora of staff and a plethora of resources, how can we be stewards of wellness and stewards of prevention and help gain buy-in from other departments, from faculty, from academic advisors? How can we engage them in some of our efforts? So that's one of the things that we're really trying to focus on. This year we're rolling out a comprehensive plan on how we can engage academic advisors specifically in some of the work that we do. So we're really excited about that, and I'd be happy to chat with anyone offline about some of the work that we're doing in that space. A couple other things that I wanted to mention that we are doing on Ohio State's campus. So we are using some of the tools that are provided by the Higher Education Center, one being ScreenU-Rx, which is based in SBIRT, which is Screening, Brief Intervention, and Referral to Treatment. We have had over 10,000 users, screens, or roughly 10,000 screens since August, which we're really excited about. But you have to get creative in how you do that. Obviously, there's we use incentives a lot of the time to help increase our numbers there, but we also incorporate it in all of our intervention programs. We incorporate it in all of our workshop series. So we're just trying to increase the amount of screenings that our students are engaging in so that they can get a snapshot of their use, how their use is affecting their holistic well-being, and then connect into resources if they do use. And also I wanted to mention our student health services has also installed a permanent drug collection unit within their pharmacy, which is very exciting. So students have access to drop off any of their excess prescription drugs in a safe, secure location. That is something that just rolled out this academic year, which we're really excited about. But I think that student health services or your pharmacy can be extremely valuable partners in this work. We are exploring ways in which we can put messaging or the social norm messaging within the prescription bags at our pharmacy. And so getting creative about how you get the message out and engaging in partners, because no one person, no one unit can address this issue alone. So I also wanted to briefly mention, because I'm sure many of you are probably have seen this multiple times, but SAMHSA has some really, really great resources when it comes to prevention as a whole. And one of the ones that we really use as a framework for a lot of the work that we do is the SPF, the Strategic Prevention Framework, which you see here. It's really valuable, and it walks you through a step-by-step process on how you can implement prevention strategies and assess prevention strategies on your own campus. So the first step is oftentimes the assessment step. So what's the problem? How can I learn more about it? And that is where the prescription drug study comes in extremely beneficial, because we have the data. We have the data for our specific campus. We have the national data, and we can use that to inform some of the work that we're doing. The capacity building. So what do I have to work with? Oftentimes, this is especially with prescription drugs, might be the most challenging because there's not a lot of resources being put specifically towards prescription drug misuse on the college campus. So that's where the partnerships come into play. Then you go into the planning. What should I do? How do I do it? When do I do it? And then the implementation stage, so try it out, and then the evaluation stage. The beauty of this model is that you can continue to go through it until you get some really evidence-based practices that really create an impact on your campus. So I wanted to mention that because I think that it is a very valuable tool for really any of the work that you're doing on your campus around prevention. In specific to prescription drugs, SAMHSA also has a couple tools that they rolled out, I believe in 2016, that I briefly wanted to mention. So the first tool that I wanted to share is they have a huge packet that helps you identify who is at risk for prescription drug misuse. And for all of the public health folks out there and the health promotion folks out there, it's helpful that this model is developed using the socio-ecological model. So it identifies who's at risk based off of the socio-ecological model, and which looks at the individual, the relationship, the community, and the society factors that influence risk. We know through some of the research that's out there, most of the risk factors are at the individual level. So it's age, it's socioeconomic status, it's health. And when I say health, I don't mean just physical health. I mean mental health. I mean all aspects of health. So that's something that we need to keep in the back of our minds. Then after identifying who's at risk, SAMHSA has a tool that helps you implement various strategies. There's no one silver bullet or one strategy that works for everyone or every campus or every community. So it's simply based off of the needs of your specific population. The different subgroups are listed below. The educational programs that SAMHSA highlights are specifically aimed to raise awareness of the dangers of misusing, the laws, the policies, and the social norms around prescription drug misuse. And I think the laws is one of the things, too, that we're really trying to focus on here on our campus, because students don't understand the consequences that really come from sharing prescription drugs amongst themselves or selling prescription drugs to their friends and things like that. Tracking and monitoring. So this goes back to that idea of doctor shopping and pill mills. So there are, electronic systems in place that help do that. But on the college campus, we just need to listen to our students. If we know that there's a source of prescription drugs in the area, we need to look into that. We need to engage the proper partners to be sure that we are preventing these specific challenges from engaging with our students and infiltrating our campus community. Proper medication disposal, so that's all about limiting access and availability. Many campuses do drug take-back days, but I would encourage you, if your campus doesn't have a permanent drop box for disposable medication, I would encourage you to really advocate for that, because that's something we're really, really excited about here, and we think it's going to create some great support for students wanting to access a way to dispose of their medication. And then the harm reduction, obviously reducing the negative consequences. A lot of our work across prevention is housed in harm reduction, so we know that those are proven strategies as well. And then multi-component, so that's taking various strategies that have been outlined already and implementing them together, which is also proven to be effective. The last thing that I just want to share is I want to reiterate the fact that although prescription drug misuse probably isn't the most prevalent issue on your campus, it's worth addressing. There is a very fine line between using a prescription drug, misusing a prescription drug, abusing a prescription drug, and moving on to dependency. So we need to be sure that we can be true prevention specialists and stop this from happening before it gets to the point where someone is dependent on these substances. So like I said, I'm happy to talk about any of the work that we're doing at Ohio State offline at some point, but I guess I'll turn it back over to Erica now.
So at this point, we're just going to talk briefly about some key takeaways, and then we really wanted to leave time to open it up for all of you to ask any questions. To reiterate, as Blake said, if you have questions for Blake, feel free to talk to him, after the webinar. But also, if you have questions about the study itself, the College Prescription Drug Study, and we don't have a chance to answer it, or you think of it tomorrow morning, please don't hesitate to reach out to us. We're always happy to talk about the study. We're really passionate about sort of this area, and want to make sure that your questions get answered. So when we think about key takeaways here in terms of, what Blake just talked about from an education perspective and what the study kind of shares with us, we really come away with 3 or 4 kind of key takeaways that we as sort of a study team and practitioner team have really come together around. So the first of those is that most students are not misusing prescription drugs, but we're still concerned about the students who are using. We still want to make sure that we're addressing this and thinking about this. Second is that we continue to have opportunities to educate students about safe use of their prescription medications, especially the storage of them and not giving them to friends or selling them to friends. So continuing to think about that and to find ways in which to continue to measure that will be priorities for our team. And then third, we were really heartened that most students know where to go to learn more or to seek help about prescription drug use, safety, or help in the case of misuse. So we really see that as another sort of takeaway from the study of knowing that these students, they really do sort of know where to go if they have questions about that. And then I think, our last takeaway is, as Blake said, really building these partnerships across campus, within the community even, and really continuing to extend them so that we really have multiple sources of information all coming together to be understanding this issue as much as we can on our college campuses, because it is an issue that is not always highly visible. And so it's something we want to really be intentional about continuing to think about. And then our last slide here is just the want to know more. So if you go to this website, you'll be able to see our key findings report, the overall national descriptive report that outlines the 4-year public institutions compared to 4-year private institutions who participated in the college prescription drug study. And then you'll also be able to see regular research briefs that we're updating on a fairly regular basis about different topics within the data. So to give you an example, we have a research brief up there right now about differences in prescription drug use by class rank. We have a very focused one that's really about stimulants. So for those of you who want to know more, who are really interested in this, know that we are continually updating that website with deeper analyses that we're doing around the data to really understand what's going on with this issue.
Okay, well, thank you so much to our entire panel for being with us and sharing more about the College Prescription Drug Study. Now is the time to submit your questions, so I encourage you to do so in the question box in the control panel on the right-hand side. As we wait for questions to come in, I do just want to let everyone know about some things that are coming up at the Higher Education Center. You can stay up to date on our webinars and other events and training opportunities that are available through the center by visiting our website, hecaod.osu.edu, as well as following us on social media. Our call for proposals for the 2019 national meeting is open right now through March 1st, so we encourage you to visit our website and learn more about how you can submit your proposals for consideration at that conference happening at the end of July, beginning of August this summer. We are starting to get a few questions, and my first question is for Blake. Blake, can you share a little bit more about the grant resources that you referred to related to social norming campaigns? Where exactly can people find those that are interested in them?
Yeah, so a couple of the colleagues in the Student Wellness Center really learned through them as part of our social norm campaign development. A lot of what we did through that was reach out to other colleagues to see what they're doing in this space. And if I'm not mistaken, I believe that folks through the Social Norm Center at the Michigan State University, there was actually resources listed there. But if you want to contact me, I will put you in touch with the staff member that we have that's working on that, and I can share with you specifically where to find those.
Okay, thank you. And we have another question for you, Blake, if you don't mind. There's interest in learning more about about how you might use the study to impact the work that you're doing directly here? Has there been something that from this data collection, can you speak to any of the changes that you may have made in response to the data that's been collected from this round of the study?
Yeah, so I mean, I think that, to be honest with you, one of the big things that we're doing is the development of the social norm campaign. We have heard from students through our workshop series, through our one-on-one interventions with students, all of the time, almost on a daily basis, students have such misperceptions about the use of stimulants and pain medications and sedatives on our campus. And we haven't done a social norms campaign here in at least 5 years or so. And we realized that since looking at this data, we realized that this is an area that is of need here. And so that's why we're really so invested in the social norms campaign, is because we know that there are incredible misperceptions out there about use, not only with prescription drugs, but also alcohol as well. So we'll be rolling that out in the fall. I also want to mention, too, that we have incorporated this data not only in our prescription drug specific programs, but also in our stress management programs, also in our study skills and academic performance, intellectual wellness programs, because all of these things are interconnected and intertwined. And we use this data to help show that the vast majority of students are studying in a healthy way. The vast majority of students are sleeping in healthy ways, and they're not using substances. So it's all about correcting those misperceptions that are out there.
Excellent. And could anyone from the team for the Center for the Study of Student Life speak to this question? We have someone who's interested in knowing if the data collection, the data that you collected, did any of it relate to socioeconomic status or the rank of a college student's high school ranking?
That's a great question. So for the first piece of socioeconomic status, we do not measure that. We do have a measure of parental education in the data, so we know if they're a first-generation student or not. But we don't have a measure of parental income because often when we've asked about parental income in the past, and it can be really challenging to get on par estimates of parental income. In terms of the second question, which was, can you remind me again? Oh, high school rank. I'm there. High school rank, we do not have high school level information. So one of the things we didn't mention about this study is that it's anonymous. So students respond to this study, and because we're asking them about illegal behaviors, we really work diligently to ensure that their responses are in no way identifiable. And so in doing so, that means we really don't even have the option to have any high school information, and we don't ask them to self-report it because we're asking graduate students in some cases about sort of their behaviors as well.
Thanks, Erica. And I'll open this question up to anyone. Could one of you, though, speak to how marijuana, whether it is being used as a legal substance in a state or not, may play a role in prescription drug misuse and self-medication on campuses?
Oh, so I can jump in a little bit here, and then maybe we can pass this one around. But, I will say that this is not necessarily my area of expertise. So, in thinking about, but I do think that something we're always thinking about are sort of changing laws and changing norms, especially when it comes to marijuana use, which is our sort of most recent example of a changing social norm in terms of how students are using substances. And we're definitely thinking about that in terms of the instrument itself and how we continue to construct the instrument so that maybe we are making some space for some state-by-state considerations. But in terms of, thinking about marijuana use and like does it lead to prescription drug use, which I think is maybe some of the underlying question there. Our data can't really speak to that. And so I think that would be, a study of perhaps a different scope that really is kind of interested in some of those more causal mechanisms rather than really understanding the snapshot of what's going on at a particular moment.
And one thing that I will add too, even though the data that we have doesn't specifically speak to this, is the fact that some of so we have a K6 program, and it's a one-on-one intervention program for students who have violated the policy around marijuana use on campus. Oftentimes we have students who come to that program that do use, they're in the high risk level when it comes to marijuana use. But a lot of what we're hearing from those students is that they use marijuana after a night of staying up all night studying on stimulants. So I think that they're using it to, once again, to perform by sleeping better and to come down from that stimulant high, for lack of a better term. So I think that there are some students, at least anecdotally, that we've worked with that are using both simultaneously for very different purposes, but to essentially combat the effect of the other.
Great, thank you. And could one of you share a little bit about if you collected data specific to whether a student is engaging in Greek life? Is that something that you were able to tell from the study? Were there any differences in substance misuse among individuals who maybe are engaging in that community versus students who are not?
We do ask if students are part of a sorority or fraternity, a social sorority or fraternity, and that is on our list for research briefs to write. So check that website that I put up probably in 3 months or so. We're hoping to have that one done. But yeah, I can't speak to that. The analyses are not complete yet.
Well, I'm sure there's lots of us that'll be anxiously awaiting that. So we welcome you to share that with us at the center. We'd be happy to pass it on to everyone once it is complete. We also have a lot of interest in when the next round of administering the CPDS is and how campuses might be able to participate.
So the next round of the study will be in spring of 2021. So the study's on a 3-year cycle. So since we ran in 2018, we'll run it in 2021. That allows for really good trend data kind of over time without over surveying students. If you're interested in participating, please email us at rxstudy@osu.edu. But Cindy can also kind of get you in contact with us or go out to our website and it has all the information. It's also free to participate in. So, we're really excited that this is a service that we're able to offer in terms of helping campuses to understand what non-medical use potentially looks like on their campus and really have some comparisons with other, usually 4-year institutions, but also 2-year institutions. It's really open to any higher education institution in the US. So if you have questions, let us know. But 2021, signups will probably start next winter.
Great. Well, thank you so much. The last question that I have is actually a really nice segue into our closing, and it was specific to Screen U around the steps for implementing Screen U. And so I think it's a nice time to mention that our March webinar will actually focus around Screen U. And so in your follow-up email, you'll receive information on how you can register for that webinar taking place March 20th at 2 o'clock Eastern Time. We also, of course, have a lot of questions about how you can access the recording of this webinar, and the recording as well as a handout of the slides will be available on our website, hecaod.osu.edu, within 3 business days. And we'll also include a link for how you can directly access that in your follow-up email as well. Well, I would just like to thank again our panelists today for being with us and sharing more about their experiences and the work that they're doing around the college prescription drug study, and thank all of you for joining us this afternoon. Hope you have a wonderful day.